Welcome back to Searching for Peace. Today we're going to be discussing empathy. We will again start this topic by referencing Merriam-Webster's dictionary. Empathy. 1. The action of understanding, being aware of, being sensitive to, and vicariously experiencing the feelings, thoughts, and experience of another, of either the past or present, without having the feelings, thoughts, and experience fully communicated in an objectively explicit manner. Also, the capacity for this. 2. The imaginative projection of a subjective state into an object so that the object appears to be infused with it. That can be a little confusing. Empathy is your ability to feel or interpret the feelings of others around you. As Simon Baron-Cohen explains, empathy occurs when we suspend our single-minded focus of attention and instead adopt a double-minded focus of attention. This means that your ability to see outside your own perception is a level of empathy. If you are unable to recognize other people's perceptions, then how will you know if what you're doing is causing them physical or mental anguish? Empathy is a spectrum, with some feeling 0 levels of empathy and others feeling enough to immediately know how someone is feeling based on their eye movements, facial expressions, and body language. As explained in The Science of Evil, reasons that someone could feel lower or no empathy include genetics, upbringing, psychological disorders, and many other contributing factors. What is common in all factors is that the empathic circuits within the brain do not connect as a healthy brain should. Through medical scans, doctors and psychologists have been able to determine how much these areas of the brain light up when shown facial expressions, people being harmed, and other photographs or sounds. This shows a scientific correlation to people that show different levels of empathetic capability. This is not a pseudoscience or supernatural observation. This has been observed and repeated in hundreds of patients. Tests have been conducted where 2 patients were being scanned at the same time. When one patient has their hand pricked by a needle, we see the portion of the brain light up that corresponds to that pain. The patients with average to strong empathetic levels have the same area of the brain light up, while a patient with little to no empathy shows little to no activity when observing the patient being pricked by the needle. One of the first cases that strongly supported these theories was the case of Phineas Cage. Phineas was a perfectly reasonable and likable person based on testimonies from friends, family, and colleagues. He was what you would likely have considered a good person. This changed on September 13th, 1848, when Cage was in a work-related accident that drove a metal rod into Cage's head. This rod went through a part of his brain, but he did not lose his life or even consciousness. He drove himself to the hospital and survived the incident. Everything seemed perfectly normal at first, but this quickly changed when the people around him began to realize that his personality changed. Phineas showed childishness, irreverence, rudeness, and social inhibition. This is because the accident destroyed the part of his brain that allowed empathy. This is just one example showing how someone's actions, if not logically directed, can become evil without conscious effort to do otherwise. This shows us that it is possible to be evil without it being blameworthy. If someone isn't given or able to receive a proper set of guidelines to do the right thing. What do different levels of empathy show? There are 6 levels of empathy as written by Baron-Cohen. Each of these levels shows different characteristics, and it is important to remember that this is a spectrum. No one is strictly 0 or strictly 6. While reading these, you may see characteristics that remind you of people you know. Remember, that level of empathy does not correlate to that person being a bad person. This means that the empathy circuit in their brain doesn't allow for this, and it isn't their fault. The only time that they can be blamed or praised is when what they have done is with the knowledge of the outcome of their actions, i.e., if they knew that doing a thing would cause harm before doing it. Level 0. This person has little or no empathetic abilities. This doesn't mean that they will cause evil, because this also must be compared with another spectrum that we will discuss further on. Level 0 types. These include 3 negatives and 1 positive. The 0 negatives are psychopath, borderline, and narcissist. And the 0 positive, autism. The first 0 negative is a psychopath. These personality types are able to decipher and read other people's emotions, but they are unable to feel them themselves. This means that they feel no guilt or pain from someone else, or causing pain to someone else. This allows them to often be manipulative to fit their own needs. These personality types are the most likely to ignore any rules of morality set in place, because it truly does not affect how they feel if they don't follow them. This doesn't guarantee an evil person, because they do have the cognitive abilities to make the right decision. Approximately 3% of males and 1% of females fit into personality type psychopath. About 50% of these males and 25% of these females make up the prison population. Next is a person with borderline personality disorder. This means that they bounce between their abilities to deal with people because of their inability to feel what they feel. They may or may not know how someone is feeling at a given time. A borderline personality rarely knows of their own disorder. These personality types make up around 2% of the population. For those that attempt psychiatric assistance, that number raises to 15%. Among suicides, this jumps to 33%, and among known drug users, it reaches 50%. This is truly a miserable existence. A person with borderline personality disorder craves love and attention, but when they receive it, they are unable to trust that it is genuine. They often lash out with the belief that they are correct, without seeing what pain they are causing. Last of the zero negative personalities is the narcissist. A narcissist has no issues feeling his or her own emotions, but they have no ability to feel or determine the emotions of others. This personality type is rarely able to take it into consideration that anything is their fault. Since they are unable to determine the feelings of others, they fill those feelings with their own assumptions. If someone doesn't want to be around them, they assume that it's because that person is at fault. These personality types have very little interest in anyone else's perception if they ever realize that other people have their own perceptions. These personality types live in a constant sense of entitlement, even if they have full knowledge that this isn't true. Through testing, narcissists make up about 1% of the population, but it is believed that this number is closer to 16%, based on the fact that most narcissists would never seek treatment, considering that they don't believe there is a problem. Seropositive empathy types are still not able to have empathy towards other people, but they cause no direct action to harm other people or their environment. Any harm caused by these empathy types is through lack of knowledge and indirect action. Next, we have autism. Autism itself is a spectrum, and not all people with autism have zero empathy, but zero empathy is often found in people with severe autism. Autism is less likely to be able to learn or interpret emotion, but they feel their own strong emotion. People with severe autism often see other people as objects in their reality. They may grow fondness for a person, but this is the same fondness that they are likely to get from their favorite toy. This type of autism often prevents the brain from making decisions based on previous knowledge. Level 1. These are people who are able to do harm, but they are able to reflect on what they've done after. People with level 1 empathy circuits struggle to control themselves when they are feeling strong emotions. It's not that they don't know they are causing harm. It's simply that their needs take over others at the time. Level 2. Here, a person still isn't necessarily able to stop themselves, but they immediately feel the consequences of their action. Often, this empathy level can be corrected if told during the action what they are doing. Level 3. These people have full knowledge of their lack of empathy. This causes them to often avoid situations that may be highly demanding of their empathetic capabilities. Level 4. This empathy level makes people much more capable of handling social situations, but they are still more comfortable to avoid conversations dealing with emotions. They would much prefer to talk about facts and fixing something technical. Level 5. This is the level that people are much more capable of having productive and mutual relationships. They are able to contribute and enjoy full relationships. Level 6. Upon reaching level 6 empathy circuits, people are regularly and proactively trying to cater to other people's emotions. These people work well as counselors and caretakers. They so intently feel others' emotions that they want to make everyone feel good and therefore gain those same feelings themselves. On the other hand, these people are likely to feel personally responsible if they are unsuccessful and struggle to cope with relationships of people with negative or destructive emotions. Different variances. Determining what level you are at doesn't mean that level is a constant. More research is being done to determine whether or not these empathy circuits in the brain can be repaired. It is also worth pointing out that even in a perfectly healthy brain, your empathy level can change over time due to other factors. These include, but are not limited to, PTSD, waves of depression, lack of sleep, hunger, stress, and the list goes on. No matter what your level is, it can fluctuate. This leaves hope for those with little or no empathy because there is the possibility of correcting these circuits. How to learn your empathy level. Simon Baron-Cohen, along with many other psychologists, have actually put together a test that you can take in order to learn your empathy level. Be sure to follow the link in the description below to take the test yourself and find out where you place. Once you have taken the test, you can look at these results to find out more. Someone who scores 0 to 32 has low empathy. Most people with Asperger's syndrome or high-functioning autism score around 20. These people have strong trouble with social situations and tend to avoid them unless they have knowledge or training to deal with the problem. This group is often seen causing pain, but rarely have knowledge that they are doing it, simply because they aren't able to understand the unspoken vibes or feelings of the people around them. People scoring 33 to 52 are average. Women usually score about 47, and men usually score about 42. This is where most of the population lie. Here, people have enough understanding to make good social decisions, but are just as likely to misinterpret the people around them. People who score 53 to 63 are above average. People that fall in this group are able to interpret people's emotions very strongly and thrive in social situations. Most strong extroverts will fall in this area because they are able to read and easily adjust their own personality to make the people around them comfortable and confident with their presence. People who score 64 to 80 are very high. Here we start to see where there is a divide within the group. While some of these high-level empaths are able to use this to their advantage and be able to thrive, others are left uncomfortable in social situations. Most people in this group can spot a lie or inconsiderate act immediately, but know that by calling someone out on their lie or action with no evidence, aside from their strong sense, would end poorly. This regularly leaves them in an uncomfortable situation, but they are unlikely to cause harm by accident because they have a strong understanding of how people feel. What we have learned from these tests. Using this test, psychologists have been able to determine a pattern in the general population. This has been confirmed with multiple control groups as well as with neurological scans to corroborate findings with the test subjects in the control groups, which would be considered general population. Here we see the percentage of people that fall within the empathy quotient test. Here you see how the majority of the population lie in the average area. This means the majority of the population, in theory, have equal capacity to do good or bad to others due to lack of empathy. When administering these tests with the criminal population, we see a very similar spectrum. Unfortunately, criminals are unlikely to voluntarily admit themselves for such testing. This is how you can see that people with psychopathy, borderline personality disorder, and narcissism are more likely to commit a crime before they are noticed or helped, while highly autistic and Asperger people seek help and are able to be guided with a rule set and understanding to be good, or at least not evil, for the world around them. With this information, we can see that the lower the empathy level you have, the more likely you will be perceived as evil or able to commit evil acts without direction. This is not the only factor, however, because you may have no empathy, but you may still have the ability to see patterns and therefore be able to deduce feelings from people, even if you don't feel them yourself. In the next part of this series, we will again reference Simon Baron-Cohen with a test which grades your brain's level of systemizing.